Have you noticed yourself running to the bathroom more often than usual? Maybe you wake up several times a night, unable to get the deep, restful sleep you need. Or perhaps you find yourself scanning every building for a restroom during the day. Frequent urination is more than just an annoyance. It can affect your sleep, your work, your confidence, and even your relationships. But when this problem shows up, most people ask the same question: who should I see first? Should I book an appointment with my general doctor, the one who knows my overall health history? Or should I go straight to a urologist, the specialist who deals with the urinary system every single day? In today's video, we're going to answer that exact question. By the end, you'll understand the role of both doctors and know which one is right for you. Frequent urination may sound like a small problem, but it can have a surprisingly big impact on everyday life. At first, people often ignore it. They think it's just because they drank too much coffee or water, or they assume it's just a natural part of aging. But over time, those extra bathroom trips start to add up. Imagine waking up 3 or 4 times a night. Your sleep is constantly interrupted, and in the morning you feel drained before the day even begins. Over weeks and months, that lost rest affects your concentration, your energy, and even your mood. Many people also start to feel anxious about leaving the house, worrying whether they'll find a restroom in time. This turns what seems like a small inconvenience into something that affects work, social life, and self-confidence. Even more importantly, frequent urination can be an early warning sign of deeper medical issues. Urinary tract infections can spread to the kidneys if left untreated. Diabetes can silently damage nerves and blood vessels, showing up first as more bathroom visits. For men, prostate problems like enlargement or inflammation may cause difficulty emptying the bladder, which leads to frequent urges. And in rare but serious cases, bladder cancer can also present with these symptoms. The takeaway is clear. Frequent urination is not just an annoyance. It can be your body's way of telling you that something important needs attention, and the sooner you act, the easier it is to treat both the symptom and the underlying cause. When frequent urination first becomes noticeable, most people turn to their general doctor, also called a primary care physician. This is often the best starting point, especially if it's the first time you are experiencing the problem. A general doctor knows your overall health history, your medications, and your lifestyle, which makes them well equipped to connect the dots and look for common causes. During the visit, they may ask basic but important questions. How long have you had this problem? Do you wake up at night to urinate, and how often? Is there pain, burning, or blood in the urine? Do you feel unusually thirsty? These questions help narrow down whether the issue might be related to an infection, diabetes, or lifestyle habits. A general doctor can also run simple yet effective tests. A urine test can show signs of infection. A blood test can reveal high blood sugar or kidney function problems. They might also check blood pressure, weight, and review your current medications, since some drugs like diuretics can cause more frequent urination. For many people, this first level of care is enough. If the problem is a straightforward urinary tract infection, the doctor can prescribe antibiotics. If high blood sugar is detected, they can start diabetes management. And if lifestyle factors like caffeine or fluid intake are contributing, they can guide you with practical adjustments. However, general doctors have their limits. If the issue is more complex, like an enlarged prostate, recurring infections, or unexplained symptoms, they will usually refer you to a specialist. And that's where the role of the urologist becomes essential. A urologist is a medical specialist who focuses exclusively on the urinary tract, the kidneys, bladder, ureters, and urethra. And for men, the reproductive system. While a general doctor can recognize patterns and treat common causes, the urologist has the training and equipment to go deeper and uncover issues that may not be obvious at first glance. When you visit a urologist for frequent urination, the process is much more detailed. They don't just ask how often you use the bathroom. They want to know when the problem started, how it affects your daily life, and whether other symptoms are present. For men, they may perform a prostate exam to check for enlargement or inflammation. They also use specialized tools, ultrasound scans to see how well your bladder empties, Doppler tests to evaluate blood flow, and cystoscopy if they need to look inside the bladder. Blood and hormone tests may also be ordered. For example, testosterone or thyroid levels can influence urinary symptoms, and these are areas general doctors don't always check. Urologists also investigate neurological causes, since nerve problems can affect bladder control. This level of evaluation allows them to diagnose complex conditions such as overactive bladder, prostate enlargement, BPH, kidney stones, or even bladder cancer issues that cannot be fully identified with basic tests alone. In short, a urologist brings a depth of expertise that ensures nothing important is overlooked. If your symptoms are severe, persistent, or getting worse despite general treatment, going directly to a urologist can save valuable time and protect your long-term health. One of the biggest questions people have is, should I see my general doctor first, or should I go straight to a urologist? The answer depends on the severity of your symptoms and your overall health history. If your symptoms are mild, new, or seem connected to lifestyle factors, starting with your general doctor makes sense. For example, if you recently increased your caffeine intake, are under a lot of stress, or are drinking more fluids than usual, your doctor can help you identify these habits and make adjustments. They can also run routine blood and urine tests to check for infections, diabetes, or kidney issues. For many patients, this step provides clarity and simple solutions without needing a specialist right away. However, there are situations where going directly to a urologist is the smarter choice. If your symptoms are severe, such as urinating every hour, waking up multiple times at night, or experiencing pain and burning, it's best to see a specialist quickly. Blood in the urine, weak urine flow, or a constant feeling of incomplete emptying are also red flags that point toward conditions like prostate enlargement, bladder disease, or even cancer. Men over 50 should also consider seeing a urologist early, since prostate problems are common in this age group. And if you've already tried treatment from your general doctor, but your symptoms persist or worsen, that's a clear sign to seek specialist care. The bottom line is this: both doctors play important roles. A general doctor is great for first-line evaluation and broad health checks, while a urologist provides deeper, specialized care. Choosing the right one at the right time makes all the difference. Frequent urination is more than just a daily inconvenience. It can disrupt your sleep, lower your energy, and most importantly, signal deeper health problems that need attention. The key is knowing where to start. A general doctor is often the first step, especially for basic tests and overall health screening. But when the problem is complex, persistent, or severe, a urologist is the specialist with the training and tools to uncover the real cause and guide you toward the right treatment. So don't ignore the signs. Don't wait until the condition gets worse. If you're struggling with frequent urination, take action today, whether it's making an appointment with your general doctor or going directly to a urologist. Your health, your confidence, and your quality of life are worth it. If you found this video helpful, please like, share, and subscribe for more health insights that could make a difference in your life.